Now we are going to move on to the next Center for Economic Opportunity. Jonathan Mintz, the Commissioner for the New York City Department of Consumer Affairs, and Veronica White, the Executive Director of the Center for Economic Opportunity. It is so great to welcome you here today.
Thank you very much. Good afternoon. I'm Veronica White, Executive Director of the Center for Economic Opportunity, better known as CEO. And I'm joined today by Commissioner Jonathan Mintz of the Department of Consumer Affairs, who's filling in, thankfully, for Deputy Mayor Linda Gibbs, who unfortunately had to be at City Hall this afternoon. In 2006, Mayor Bloomberg established a Commission on Economic Opportunity to bring new public commitment and ideas to the task of reducing urban poverty. The Commission found that there were 1.5 million New Yorkers in poverty and identified 3 groups that could benefit the most from strategic interventions: young children, the working poor, and young adults. To implement the Commission's recommendations, the Mayor took 2 major steps. First, for the management of the programs, he established CEO, and to increase its effectiveness, placed it within the Mayor's office. Second, for financing, he created an innovation fund, a new, flexible funding stream made up of public and private dollars that is managed by CEO. Financed annually by the $150 million budget, CEO works with 20 different city agencies to implement and evaluate dozens of innovative anti-poverty initiatives. CEO has the authority to create cross-agency initiatives, to mandate results in exchange for the funding, and to terminate funds when programs don't perform. This positioning is one of CEO's greatest strengths. Another is Mayor Bloomberg's political will, which has greatly increased the priority and importance of anti-poverty work in New York City, and as a result, the nation. We're proud to say that with the leadership of the Mayor and a new commitment to evidence and evaluation, we've been able to make great strides in a very short period of time. We've learned a lot, and this experience will help New York City to spend our federal stimulus funds more wisely. We're also sharing our lessons learned from CEO with programs across cities across the nation, as well as with decision makers in Washington. What's more, CEO itself is an effective model that is ripe for replication in other cities, states, and the federal government. In fact, we've been in discussions with the White House about replicating CEO in the form of a federal urban innovation fund, and 25 mayors across the country have joined our call. In creating and funding initiatives, CEO is guided by 4 principles: innovation, effectiveness, major impacts, and replication. One of our most innovative efforts was our work to make New York City the first locality to create an alternative to the federal poverty measure. Our work has proved to be a catalyst at the federal level and is a key driving force behind congressional legislation to finally update the poverty measure. CEO's Innovation Fund requires extensive data collection from the programs it supports. Based on the evaluation data, programs that prove successful are maintained or expanded. Those that fail are terminated. Just last month, we made our first announcement about program successes and failures. With 11 promising programs and 6 that are being discontinued, we are staying true to our Innovation Fund. Commissioner Mintz will now describe one of our most successful CEO pilots, the Office of Financial Empowerment, the first local office of its kind and a tremendous asset to both our other CEO programs as well as to localities across the country.
Good afternoon. I'm not Linda Gibbs. I'm Jonathan Mintz. I'm Commissioner of the Department of Consumer Affairs, which was home to CEO's first initiative. It's really emblematic, the Office of Financial Empowerment. It's emblematic of CEO's innovative thinking that it would seed a financial empowerment mission within such a non-traditional agency. OFE's mission to improve financial stability bore fruit quickly, leveraging CEO's conditional cash transfer program to create a safe starter bank account for program recipients. CEO's high-profile program allowed OFE to leverage a smart and safe banking product that we branded Opportunity NYC account, working with a handful of banks and credit unions. The confluence of forces worked. In the first phase, we've gone from 56% of the program participants who were unbanked to 5%. Our annual tax credit campaign not only raises awareness of the Earned Income Tax Credit, but was also the launchpad for CEO's child care tax credit. New York City is one of the only municipalities to have its own such credit, and in its first year, more than 50,000 New Yorkers with low incomes were able to claim it, receiving more than $30 million. More New Yorkers than ever are responding to our outreach and claiming their refunds, close to 850,000 people, in fact. But CEO programs went a step further, with our finance department successfully identifying more than 22,000 people who had missed claiming these refunds. The city now prepares and mails to those households amended tax returns that need only be verified, signed, and submitted. Over the past 2 years, New Yorkers have collected nearly $14 million in tax credits thanks to this program, and the IRS, as we speak, is replicating this program in 5 states, including the great state of Maryland. Other CEO programs are serving as effective models. For example, OFE founded and co-chairs the National Cities for Financial Empowerment Coalition. This coalition helps replicate the most successful municipal efforts, including our financial education network and our citywide network of financial empowerment centers offering free one-on-one coaching. In the end, the Innovation Fund, managed by the Mayor's Center for Economic Opportunity, is well positioned to incubate non-traditional, results-oriented approaches, many of which are being replicated across the country. Thank you.
Thank you. David had a question, then Maria and Ed.
Yeah, this is a fascinating effort. I have 2 questions. The first one is very simple. Of the $150 million, and it's not $150 million a year, it's just a lump sum 150.
No, it is $150 million annual.
Annual.
Per
Okay.
year.
How much of that is public and how much private money?
125 is public and 25 is private.
Okay. And then the more complicated question is, the site visitor mentioned in his report that because you're in the mayor's office, you have the power to kind of reach into departments and, as he put it, drive reform and innovation across all units of city government. Could you give us some examples of that, if it's actually true?
So I'm at City Hall, and I have a very small staff of 12 individuals, half of whom are working, led by Mark Levitan, in revising the poverty measure, and the other half work on evaluating programs with external evaluation teams. But I work with 20 different city commissioners. Jonathan is one of our stars. And he himself established a CEO program that we created together called the Office of Financial Empowerment, which has a staff of 20. So his staff of one of my programs in his agency is larger than my staff. We were able to work with not only his staff, but when the Department of Finance came up with the idea with CEO of, for example, sending out our EITC returns that was just described by Jonathan, we made sure that all of our agencies and commissioners are in sync and working together. Very often, and I should actually let Jonathan speak for it because he's a great example of our ACS, our Children's Services Department, was attempting to set up an IDA program for some of their youth aging out of foster care. And again, Jonathan's team stepped in.
The beauty of having this mission housed in City Hall by sort of, as you said, pushing and also supporting this work within the divisions is that when a department has a mission, for example, our financial empowerment mission, we're well positioned to be able to insert it into the other relevant programs of other commissioners. And as you know, there can sometimes be silos traditionally within government. By having this housed at City Hall, those silos are automatically broken down. And so as she mentioned, for example, when our children's department was working with foster care youth, we were able to step in from a financial empowerment perspective and talk about banking and asset building for that particular population.
Maria.
So the description of some of the programs that you gave in terms of increasing access to child care credits, EITC, how do those relate to the overall mission of reducing poverty? That accessing benefits or credits, one might say, isn't really going to the underneath problem. Can you give me examples
So we have
about
40
how those programs
We have
fit?
40 different programs, and each of them are evaluated. We actually, our first program was the Office of Financial Empowerment. Our second program was establishing for the City of New York a child care tax credit. We're the second city, following on Washington, D.C., to have such a tax credit. So what we want to do is, while giving people training, and we have 8 different programs with our Small Business Services Department. The United States Secretary of Labor, Solis, is coming tomorrow to make an announcement with our mayor about some of our CEO programs. And with those programs, not only do we want people to go to work, get a better job, get better training and education, we run programs, for example, with CUNY, but we also want to provide them with the work supports to which they're entitled and to which encourage them then to get back into the workforce. So families in New York City, many of the families that are in our programs are at approximately $13,000, which is the federal poverty rate, not the CEO poverty measure that we recently constructed, but it is the federal poverty level. Those families are entitled to a range of benefits, city, state, and federal child tax credits, city, state, and federal earned income tax credits that bring another $6,000 into those families. So we want to encourage them to work, make sure that they get those work supports that are necessary, and in addition give them extra training and education in order to move up ladders. And an example of that is our home health care aid program. We created a program for LPNs, licensed practical nurses. We built a new nursing school on Roosevelt Island at Kohler Goldwater Hospital. A very small program. There's only 40 participants in the first year. They all made it through, and they're all working. They went from $13,000 a year as home health care aides to $40,000 a year as LPNs. And our second group of 40 are in the program now. That's one of our smaller programs, but obviously quite successful.
Well, that is really impressive to start a nursing program when we have a shortage of nurses. Apparently we have other questions. So Ellen and Ed.
It's interesting that half your staff, Veronica, is working on the anti-poverty measures. So can you talk a little bit about the extent to which you see that as a major piece of the innovation that you've undertaken, and what is it that those people are doing?
So the first problem when the commission, and I actually was not involved in the commission process. Many of my clients who were nonprofits, leaders, were involved in the commission process, and I came in afterwards. But during the commission process, besides saying, look for innovation elsewhere, CCTs we borrowed from Mexico, a civic justice corps we're creating is based on a program in Bend, Oregon. Besides looking abroad within the cities, in the states, and abroad to other countries for models, the mayor also wanted to know, you need to evaluate these programs, pilot them on a smaller scale, and then bring them to scale if they work, and if they don't, terminate them. He also said, well, if you do X, Y, or Z, whatever ideas we came up with, what would that do to the poverty rate? So, for example, we said, we'd like to create a child care tax credit. This would be available for families that make less than $30,000 a year. It's on a sliding scale. Someone makes $10,000, they'll get more of a tax credit, $30,000, a tiny tax credit. He's like, okay, that's interesting. How many people of that 1.5 million that commission told me about is that going to bring out of poverty? And I had to say none, absolutely none, because tax credits are not counted in the federal poverty measure. So it will make no difference. So I can come and go and create all these programs. Nothing that I do is going to change that. The federal poverty measure is based on, first of all, 3 times food. Our housing costs, which are astronomical in New York City, are not counted in the threshold. And on the other side, nothing the government's done in the past 20 years in terms of the earned income tax credit or other resources are counted. It's only pre-tax income. Therefore, none of the housing subsidies, and New York has a tremendous affordable housing program, none of that is counted. So when he understood that basically everything we were doing would never change the poverty measure one iota, he wanted us to look at a new poverty measure. And what we decided to do was go back and look at what the National Academy of Sciences, we didn't invent it, the National Academy of Sciences did in 1995, and we said we're going to use that and construct our own in New York City. And that's what we did, and we told him beforehand, instead of 18% of people in poverty, it's going to go up. And so at the conclusion of my first 18 months in the job, I had to go and say, there are now 400,000 more people in poverty than when I started, because we're looking under a different measure that makes more sense, that does count everything, but that now we're looking at a threshold of $26,000 a year, which makes a lot more sense for New York City than $13,000 for being in poverty.
Thank you. And Ed?
Just real quickly, I'm a little confused by one of the statements in your narrative. On the first page, you say, the key innovation of CEO and its innovation fund is that continued funding is dependent upon positive results. And I guess I made the assumption that that would be true, at least aspirationally, of most programs. Are you saying that your innovation is that you actually cut them off?
Most programs in government are not evaluated. That may be a shock to, I'm sure it's not a shock to 90% of the room, but most programs in government are not evaluated. Programs are started often at scale, and often when you have the staff in place and the agency in place, they become big defenders of a program. And I've been in and out of government. I've been in the public, private, and nonprofit sector for 25 years, so I've seen it from all sides. And basically, yes, indeed, most programs are not evaluated. Most programs stay. Most programs stay sometimes because of advocates, sometimes because of advocates within the agency that's running it when you don't want to have to lay off 250 staff members and you can't figure out how to retool them. So yes, there's advocates within government, without government, that keep programs in place, very little evaluations done, and that is the key innovation here, is everything we do is evaluated and thumbs up or thumbs down based on what it is that actually is the outcome and the results of what we're doing in each of the programs.
I want to thank you so much. I have to tell you, when we were talking about your program, we were all extremely excited, because obviously the whole idea of innovations is to figure out what works, what's effective, and here you are, a city starting it, and it looks like it's being replicated throughout the United States. So congratulations for what you're doing.